I've never met a family who has regretted the referral to paediatric palliative care.
We often hear from families, if we'd had this sooner, things could be better sooner.
The focus of paediatric palliative care is maximising a child's quality of life. So ensuring that that child lives life fully as well as they can until they die.
Our vision is to maximise good quality of life for children with life-limiting and life-threatening conditions. It's a holistic approach to care. It's about supporting the child and the family, so it's family-centred. It's about coordinating care as a specialist team, symptom management, psychosocial, emotional, spiritual care.
It activates all sorts of conversations around memory making, about goal setting, ensuring there are no regrets in that family's life. And at the right time, it enables conversations around advanced care planning, and it also involves conversations around where the family would like their child to die. So that could be either in the family home, in a children's hospice, or in a hospital. Referrals can be accepted from as early as the perinatal stage, where a fetal abnormality or life-limiting condition has been identified.
Paediatric palliative care specialist services across Australia would say that the best time to refer is early, from diagnosis. And the reason behind that is because the services build rapport. The service providers in paediatric palliative care need to build rapport, need to build the trust. Without that trust, it's much more difficult to have those goals of care discussions. We have evidence that states parents would like to have discussions about, well, they call them advanced care directives, but I like to think of them as accumulated discussions around goals of care that will lead to agreed decisions for advanced care. They want those discussions early. They want their treating physicians who know them best to have those discussions with them, and they want them to bring up the topic. That it's never too early. What we also know is parents are often having thoughts around what's going to happen in the future, projecting towards my child is going to die from this, well before anybody mentions it to them, or before they mention it to anybody themselves.
Interestingly, what I've heard from so many families is that once their family becomes connected with the paediatric palliative care team, suddenly they have this broad network of support. They have a team that has their back. They have coordination of care and access to far more resources than they did prior to referral.
We coordinate their care. We help them navigate the system. They don't have to repeat their story as often because we get in there and do it for them. They'll need respite services and supports that we can advocate for. They need psychosocial services because of the anticipatory grief. They need social work services because of counselling support for families. Living in those situations is very isolating. It's very rare. Nobody else understands it. So these are the kind of services and supports we can put in place for families.